All right, good morning, everybody. We're live here. This is Tom Quigley with Cawfee Talk. And today, again, I have Dr. Joseph Rosado. We'll have Dr. Kelly King and Dr. Barry Gordan, who both will be joining us shortly. Good morning, Dr. Rosado. How are you?
I'm excellent. How are you doing, Tom?
I'm doing good. We're off to another Monday. I don't know what day this is on our quarantine. I think today is what, the 12th of April. So
I started I quarantined myself before the president and our governor said to quarantine, because I had been following it from all my contacts in Asia and Southeast Asia, as well as Europe. So as things were going on over there, I was calculating, okay, when it's going to hit here. And so just as I started seeing it transitioning, by February, mid-February, I was already planning and preparing. And so I had a business trip to go to in Utah at the end of February. When I got back here in March, early March, that's when I started preparing, getting my toilet paper, getting, my water, getting everything up to speed. And then as things started progressing and we were notified, like March 24th of what was going on, here in the States, by then I was already, way ahead of the curve. Now, what I'm concerned about is because I started, so early, how much longer are they going to extend the stay-at-home order, which is a concern now because as we were talking, pre-show, we were, yesterday I was watching, some of the news, the morning news shows that they have on the regular media. And on ABC this week, they had the FDA commissioner come on, and he was talking about how here in the United States, we've not hit our peak yet of positive tests. And he projects that we're going to be testing for, past May into the fall as we're testing people as the antigen, the antibody test comes up available that Barry and I had talked about last week, so we're looking at this progressing further than end of April as we were told originally. What are your thoughts?
Yeah, well, I think LA just extended their stay at home till May 15th, if I'm not mistaken. And
I heard yesterday that Puerto Rico extended it to May 3rd. We're extended to April 30th. And you said California is now May 15th?
May 15th. So, and I was thinking about that. You traveled the whole world last year, or for the past few years.
Yeah.
So you've got a lot of contacts, I know, in Thailand and Asia that relayed this. And I guess, have you had a chance to speak to any of those contacts on how things are recovering since they are farther from us?
Yes. Well, I started with China because that's where, as our president calls it, the China virus. so non-PC.
Yeah.
But I started out calling, some of my friends in China, and they're in Beijing, most of them. And so they were under quarantine for 2 to 3 weeks. And then they're all back to normal. Everything's back to where they need to be. They did tell me that a lot of the statistics that were coming from Wuhan, not to trust them because they don't keep that great of a record, system. There's the man.
No, you're the man. Hi, Tom.
Hey, good morning, Dr. Barry.
Hi, everybody.
So they are all, they were in quarantine in Beijing 2 to 3 weeks. Now the whole country's back to normal. I received notice today that from my friends in Taiwan that baseball season started in Taiwan. So they're pretty much back to normal. I communicated with some of the people in Malaysia over the weekend, and they're still under the stay at home, very strict. I mean, they're at the point of martial law. They brought in the military to oversee and be certain that the people are not traveling. And they have the essential positions as well. These people that I communicate with are a few physicians, and so they have to travel with their medical license. So if they're stopped, they pull out their medical license and say, I'm either heading to the hospital or I'm heading to my office, and here's my ID. And so, many times they're even escorted to their offices just to make sure that they're actually doing what they say they're doing. I mean, it's at that extreme level in Malaysia.
Wow. Dr. Barry, we're just talking about, how we feel that perhaps that this may extend quite farther, the stay at home, obviously. In LA, they extended it to May 15th. And what Dr. Rosado has seen with some of his colleagues in some of the other countries, and I know we just saw Michigan is starting to take a really hard stance on the stay at home order. I know you're not from Michigan, but up in Ohio, are you seeing?
It told me that way. Come on, Tom. Joe, listen, I only want to be like in Joe's suitcase with a lot of the travels that he's done. It's been fantastic, Joe, how you've really carried the message. Oh, and there's
beautiful, Dr. King.
Hey, you guys. Hello.
No matter what anybody's doing right now, we're talking about, we must all do a namaste to our colleague, Kelly, who's out there on the front lines doing
being a hospitalist.
Absolutely. So I'm going to shut up and let her give us the view from the front lines. But what Joe's talking about, I think, Tom, is what Kelly and everybody that works in the hospital environment fears, is that this has literally changed the in-hospital environment probably for the next year.
Yeah.
Because with the rolling virus that's going to be coming in and the lack of testing and the lack of a vaccine, literally the Kelly Kings of the world and the ER colleagues of mine are not going to know when people hit the hospital environment who's carrying the COVID-19 virus. So I think Kelly would agree that from 2 months ago to today, hospital environments have changed.
Oh, gosh. The hospital environment has completely changed. I was just talking to guys at 4 a.m. this morning, some of my colleagues. At the hospital I'm at, there are 4 hospitalist services. It's almost 1,000-bed hospital. It's one of the busiest in Florida, the busiest ERs in Florida. And people are afraid to come to the hospital. That's what's interesting. That is the interesting commentary here. Our hospital is about half of its census, its total overall census. People are afraid to come. So the ones that are coming are really, really sick because they've waited for their shortness of breath to get to the point where they can't breathe. They've waited until they are on death's door. So we get a lot of ICU admissions. We are now getting a lot of nursing home admissions, which is concerning to me.
Oh, man.
When it hits
Very
nursing homes, it's going to be crazy. That's a commentary,
Yeah.
because people wonder about doctor offices in general. In the medical cannabis world, we're busy right now because, let's face it, nobody wants to lose their cannabis recommendation right now.
Yeah, man. Busy.
But the orthopedic guys, the GI guys, the general practitioners, they're all down in volume. And you've seen a shifting of services.
Yes.
Endo nurses going in down to the ER and this and that. So in general, there's been a shutdown of healthcare. And unless you're in a hot zone, most of the ERs are fairly quiet.
Yep.
You're right, sicker patients in your hospital right now.
Yep.
But volumes are down, which is in reality, Tom, one of the things that we talked about last week. If this all works and the Kellys of the world manage to get through this with a change in what she's seeing every day, but not an overwhelming swamping of the system, then it worked. Then the social distancing has worked. How long we have to go with that remains to be seen. But I think what Joe and you were talking about, no one can expect to get back to normal in a day here. And that's why it's critical that we need our telehealth, at least for our research, for the next 6 months to a year, as far as I'm concerned. Joe, I know you'd agree. You don't want, and Kelly, you don't want your immunocompromised patients going out of the house for the next 6 months to a year.
No, you don't. No, you don't. Now, I certainly don't want to be seeing them in person while I'm going back and forth to the hospital. I just think that's a huge risk. Have you guys seen Joe or Barry, they have that thing on the MMUR that it's supposed to be up and running on the 15th of April. When are they going to change that?
I don't know. I keep communicating with OM and you. I've got my staff calling. Barry, you're part of the committee for the hemp in the state. You've got, Nikki's ear. Have you heard anything from her? Any support? Any ideas? Because we're like 2 days from the deadline.
Yep, we are.
I literally reached out to Holly Bell this morning, and she texted back to me. They're well aware that we haven't heard anything. As I said, it's critical today to get an answer on this because this is a scheduling issue.
Yep.
We've been deemed essential, and we know that up until May 1st, I'll be honest with you, I defy any state agency to come after me for continuing telehealth visits between April 15th and May 1st. I think first was the declared at this point legitimate quote unquote, stay-at-home order. With that, we've advanced that since the March 15th order, which is when the 1 month March 15th, April 15th. So, Holly told me that she was going to let me know, but I know otherwise, guys. Believe me, this has been discussed already. Does my sound okay, Tom? That's not my.
What's going on with the sound?
I don't know.
There's some feedback. Kelly, are you looking at the Facebook feed while we're talking, or is it no?
No, I'm not looking at.
You know what? I might have it on, Tom. So let me see if it's me. It's probably me because I had the feedback. Would you tag my page to that extent?
Huh?
My personal. I don't know. I always try to do things right, but let me get rid of something here. Well, listen, we all want the critical.
I mean, I'm inclined at this point, just like I was, 2 weeks ago, is to ask forgiveness later. I mean, we are in a pandemic, and I agree with you, Barry. I defy them. I wish they would, as my mother used to tell me when I was growing up, and I wish they would come and tell me something that when I'm just trying to keep patients safe. I can't, as much as they have on their plate, I can't.
That's not how they operate. We all know that's not how they operate.
Right.
I'm going all the way up, Tom, and then come back on, and then maybe
okay.
feel better.
One of the things that I was going to ask was, I don't know if, it must have been Dr. Barry. So, as soon as he comes back, I'll bring him on. But is there anything that we can all do? Or maybe it wasn't. It might be me.
No.
Yeah, I don't have anything on here.
Okay. So is there anything that you think we can all do as a community to get them to allow telemedicine for even the first visit for patients? Because I know there's a ton of patients that are out there that want to get their card. They're now trapped at home.
Yeah.
How can we help those type of patients?
I mean, I think it's a slippery slope. When we were in that the MMJ Justice League talk, there was a thread about that. And as you know, I used to work for Hello MD, and so I have worked with telemedicine MMJ cards, and it works relatively well. I think, however, it depends on the setting. Since I've been doing face-to-face visits here in Florida, I think that it is really a good idea because you have patients that really do need that connection. You have patients that also imparts to the patient the medicinal value of this, that this is a medical clinic. You've come to a medical doctor, you sat down and you've had a medical physical exam. And so it changes the way your patients look at this, thereby their families and their friends, it changes the way they look at it. And so I think that that's a good thing for the medical cannabis in general. So I think it presents some challenges to doctors, though, because they still need to keep up those standards for telemedicine. I think the pros of this is that we can reach more patients. We can reach more patients that are more remote. What does that do for a doctor's price point, though? That's a question. I almost feel a little guilty because some of these calls that I'm doing, especially my old patients, it's a quick 5-minute hi and bye. It's a how you doing? What are you doing? etc. And then the rest of the time we're kind of just gabbing it up for the next 10 minutes. So, you know, the what do you charge them that keeps you in business, and that is a service. Barry is right. I mean, people are not missing their follow-up visits for their medical cannabis. They're not. They need it right now. Their anxiety is way high, their PTSD, they're not everything, so they need it. So I think that it should be approached, but it's going to be a little tricky. I don't know. What do you think, Joe?
I agree with you in that the initial visit, I think it's me. Because let me turn my volume down.
Should I turn my volume down?
How about now? No, I still have that.
What are you hearing?
Like an echo.
Let me see.
Is it me?
No.
I think
Okay.
it's gone.
Yeah, that's gone now.
Okay.
Okay. Anyway, I agree with you that the initial visit, just to give it some validity and veracity,
Yes.
and it would be good. It is good to have that face-to-face encounter. However, beyond that, follow-up visits or things like that should not be done or don't need to be done face-to-face in the same room. I think
Yeah.
those can be easily done virtually. In our office, because we manage so many patients from far away, because we do pediatrics in our office, and a lot of parents will travel from Miami, Tampa to come up and see us. If we could manage those patients virtually, that would be phenomenal for them.
Yeah. Yeah. I agree. So what do we do to get the state? Well, first of all, what is the state's problem with it, do you think?
Well, the state in general, up until July 1st, they were against telemedicine in general. It wasn't until July 1st, 2018 that they passed the law where they allowed telemedicine to be done
Yeah.
in the state of Florida. So the Board of Medicine still has an issue with telemedicine as a whole, and they're just now getting acclimated to the idea. With what's been going on, they have been forced, their hands have been forced to, accept it because it's coming from the federal level and it's working its way down. And so they have to step up to the 21st century.
And it's really grown. I remember 10 years ago. Remember 10 years ago that they were talking about it. I looked into a couple of companies that were doing it, but everyone was afraid of it. Now on Indeed, and I mean, there's so many telemedicine jobs now all over. If you have 2 or 3 licenses in different states, you could really work from home and manage a very nice, robust telemedicine practice. So I think they just had to kind of come into what was going on. But then, it's a little ludicrous. If I can see a patient for shortness of breath and a UTI telemedicine, why shouldn't I be able to see them for medical cannabis?
And I also saw commercials recently for mental health check-in.
Mental health is a big one.
With psychologists and
Yeah.
It started with psychologists back about 10 years ago. They started setting up these clinics virtually where they were doing telemedicine, telehealth for mental health. So I knew a lot of, licensed certified social workers and counselors, would be at the beach, laying out, and they were consulting their patients, while they were laying out on the beach. It was phenomenal. They loved it.
Yeah. And there's such an access problem for psychiatry that it's been the perfect vehicle. I have friends from med school. They're doing really well working from home, and they've been doing that for 5 or 6 years. The medical community, like you said, the medical community has been more slow. For obvious reasons, the physical exam for one. They have telemedicine hospitalist jobs now through Sound Physician. I guess my question is, why specifically do you think that they barred medical cannabis? Because I remember this was a question when I started here. whether or not we could do telemedicine. Doctors already, you have those real cowboy kind of clinics that were doing it early on, and then they had to stop. I'm
think
just interested.
I think the whole opioid problem that we had years ago really scared everybody to err on the side of caution, where they were really afraid that, they were still afraid that cannabis was this dangerous, product, and that they didn't want to run into the same problems that they had with opioids.
Yeah.
And so for that reason, they incorporated it in the law in Senate Bill 8A, where they say, you have to be face to face in the same room. They use that language in the Senate bill to make sure that we complied with that.
But Florida's not the only one that's had that opioid problem, and there are other states that are doing telemedicine with this, and they're doing just fine.
That's because those states, the people from those states were driving down to Florida from Ohio, from West Virginia, from Tennessee, from Kentucky, down I-75, heading south to, Broward County, and then doing the doctor shopping, bouncing from office to office, getting everything, and then driving back up and selling everything, in the black market.
They weren't just driving, guys. They were flying literally from the Akron Canton Airport for $29, okay, each way down to the Fort Lauderdale Airport at a certain point. In the ER in Ohio, we were wondering where all the narcotics were coming from, because we had a narcotic registry called ORS, Ohio Automated Registry System, long before Florida had E-Force. And there's history to this. You got to look at the article that was written. What was her name? It was in the Palm Beach Post. 5-week expose, Sunday front page. What was her name, Tom? Do you remember who did that expose about the whole drug, pill milk in Florida? How there's blood on the hands of Florida. Goes back to Marco Rubio. Actually made a side deal with somebody else to block their automated reporting system, plus $2 million at the time. That was supposed to go for all kinds of things. That was back in 2010. I don't know, whatever.
The years that I was on opioids were 2007 to 2010. And I'll tell you, I had 4 different doctors that had 4 different prescriptions. And I had a flood of pills whenever I needed them and wanted them. And unfortunately, I almost died from it. You guys know that situation. With so many other people. There was no registry. There was no way to correspond that. While we're on the subject of technology, what do you guys, have you heard about this contact tracing software that Google and Apple are planning on launching that's actually being used in other countries right now?
So if people have contact, how does it work? I did see something about that. If people have contact, they can trace who that person is contacted?
Yeah, by Bluetooth signal between cell phones. So it basically, it would identify if I had COVID, and my phone would identify me as a COVID positive patient. And if I went to Lowe's and walked by, a whole bunch of people, anybody that came in proximity of me would get an alert that they were.
Like in my George Orwell 1984 book out of here.
That's scary. That's scary.
When you talk about the tracking capabilities of today, microchipping, tracking by phone, I think what we all need to understand is that we're pretty much monitored at all times. Maybe not to the extent of China. Literally, China, when you leave your home because of AI and facial recognition technology, they know exactly who you are and where you're going and how you're doing it. That's why I tell everybody it's so much better to have your cannabis card in general, because I think the government knows what you're doing anyway.
Yeah. I agree.
So,
and
I tell my patients it's going to be 5 more years in Florida of this system. Embrace it, okay?
Yeah.
Get your card, be legal, get safe, legal, educated access to cannabis. And it's the year 2020. We had this talk last week about it, but the government knows what to do.
But this contact tracing thing with the coronavirus, I mean, if there is one person that's positive, that means another 1,500 probably are. So knowing that someone is positive just means that I mean, you'd be avoiding everyone you come in contact with.
Yeah.
So
Well, the other thing is if they know that you're positive, they know where you're going and they can
I love
restrict
it.
your movement as well. What was that? Oh, it's mask. I love that mask, by the way. Who
I
made that
do.
for you, Dr. Barry?
One of my staff members, Emery Bowman, made the masks. I got a couple more, but I wanted to make like 100.
Yeah.
But the point is that as a clinician and being socially conscious, I don't want Kelly to get overwhelmed. So that's why it's critical that the state give us the telehealth capabilities right now, because I'm stuck between wanting my patients to have continued access to the medical cannabis that's essential and not wanting to break anybody's social distancing. And I had the idea 2.5 weeks ago to go out to the parking lot and see patients. Ruta Gennari, my COO, and I said, well, we can't let the press get a hold of parking lot cannabis care, okay? But it's reality now. So
It
I'm
is.
forced.
Well, the dispensaries are allowing that concept. You pull up to the driveway and they are bringing, they've got a mobile unit there and they're handing your medication. You don't even have to get out of your vehicle.
I almost look at this and I haven't made the decision yet. Believe me, I'm hoping that the state steps in today. So I tweeted on Saturday before the governor's news conference to Florida politics, and would someone please ask him the question during the news conference about the extension of the critical need for recertification via telehealth. Listen, new patients are new patients. I got it. That may be a little bit too much of a bite off for them right now, and that's a little more complicated. But we need to maintain what we have. It's very much like the fighting off of the legislative for the 10% THC cap this year. Now that we have telehealth until 2 more days, everybody. That's the crazy thing. I have 30 patients on Thursday and Friday that I can't tell that they can do their visits by telehealth. My patients on Wednesday, we have 70% of them via telehealth. Some still want to come in. Why do patients want to come in, Joe? They can't do the telehealth. You see, we got a little bit of a glitchy in the sound.
That's been the biggest thing is the technological stuff of it.
The more difficult it is to connect via telehealth. It just goes with the territory, right?
Yep.
Some patients don't want to pay by credit card. They want to use cash.
Yep.
And other patients, quite frankly, in very Republican, and I don't want to get red and blue, political discussion, but in Sarasota County, there's still a lot of people that have not bought 100% in to the social distancing. They have. So there's some patients that are going to want to come in physically, and with the new patients being needed to be seen physically. So I've talked to a lot of clinics. So people are doing 2-step new patient visits now, guys.
That's what I'm doing.
That's right. They'll do a lot of the initial visit, and then they'll just do a quick meet and greet. What I like to call Dr. Barry's side of the Jewish cross, or see Jack Cleveland Brown's jokes and get out of the way. And I think you can do that in the parking lot if you're teaching. But teaching is so difficult via telehealth, guys. It can be done, but I don't know. I just the show and tell is so important. But anyway, I don't expect the state to bite off the new patient bite right now, but we must insist on a continuation of telehealth. And I think, quite frankly, for 6 months to a year. That's my stance right now. I don't want any of my immunocompromised patients going out of their home needlessly if they don't have to, right? Over this next, that goes back to the original conversation that I popped into that you and Tom were having, Michelle. How long is this going to last? For example, if baseball comes back, okay, I think baseball comes back in Arizona, no travel outside of the states, no fans in the stands, and the players, right, are playing in small stadiums, but only in Arizona. That way, I think you control things to a certain extent. I guarantee you, football, Tom Brady, everybody's thrilled, right? In Tampa, you're not going to be in the stands, okay?
No,
Tom Brady.
This is not going to be a light switch. Our whole way of living is is changed, and that's what people have to understand. And I don't think that until they get a workable vaccine, it's going to be, it could be 6 months, a year, 2 years until they get a vaccine for this thing that everyone buys into. And it's just like the polio virus or whatever, where we can completely, if not eradicate it, we know that we have some immunity to it. It's going to be a long time. It's going to be no, and nobody's going to want to run out to the nearest concert as soon as they say, yeah, the country's back open. And the economic impact of this is huge. We're not going to see the bottom of this for a long time.
Well, the Generation Zs will be going to concerts because they have no concept.
Yeah.
Say that again.
I said the Generation Zs are going to be going to concerts because they have no concept.
Yeah,
they were the ones
you're
in
right.
the beaches for spring break.
Yeah, you're right.
On the other hand, if they find out that there's this immunity test where a large group of people are immune, what if they allow those people to go out and they track with their phones to see that the other people are staying home, and only immune people will be allowed to go out and do things for a while. And, that's one of the things they're doing in other countries. Obviously, hopefully not here, but there could be a date where, they say, oh, the people that have immunity are allowed to go back to work, but the other people that have shown to be susceptible, so to speak, need to still stay home.
I think that would be inviting anarchy. I mean, first of all, how do you enforce it, right? So now if you're going to make a rule, you have to enforce a rule or it's not a rule. So what are you talking? Martial law and then keep people home, and now they can't work, but other people can work because, some people are lucky and have immunity and some people don't. People are going to wow. That we have been,
and it's not far-fetched. That's what I was saying. In Michigan, they're really cracking down. There was even a report of somebody who was arrested for not wearing a face mask. I don't know I think that was right here in Florida, actually. So there are these different things, and I think we all just need to, continue to remain humane. But at the same time, technology is going to be implemented, I think, in multiple different ways, not just telehealth, but tracking and, even allowing certain rights of ours to be used.
Now, Dr. King, how many of your regular patients, your cannabis patients, are asking you to give them a prescription for hydrochloroquine and azithromycin?
Not many. I've had some call me for the Plaquenil. A lot have called me for the azithromycin, but not many, Joe. Not many. And I'm not. First of all, Plaquenil. We're using Plaquenil in the hospital with patients who have low oxygen, who are confirmed positive, and who are sick as hell. That being said, I have a patient in the ICU right now. He's been there since the 25th of March because I'm following every patient that I'm admitting that they have COVID and that I know they have COVID, and I keep following them to see what their course is.
What's your census right now? How many do you have?
My census right now, I probably have about 10 patients right now that are positive, that have either gone home or that are in the unit or on the isolation pod, that aren't sick enough to be in the unit, but they're sick enough to be in the hospital. A lot of patients are, the patients, they're trying to send them to nursing homes, which is a huge problem. They were doing that early on. So now we're getting these people back that we discharged back from nursing homes, along with 5 or 6 of their buddies that we think probably have COVID now. So that is going to be a huge problem with these nursing homes because it's there in the community. But that being said, the Plaquenil, I think we need to reserve it for people who are really sick. And even when we do, this guy who got a full course of Plaquenil, he's going to die any day now. We don't know that it's going to work. We don't know that it's going to work for everybody. And just writing prescriptions for it for people who ask, I think is a little, it's dangerous because it's going to lower the amount of Plaquenil we have anyway. Same thing.
Exactly. I mean, I've been getting a bunch of calls from people, they want to take it prophylactically. And strangely enough, I've gotten some calls from people, some of my friends in China that have family members here that traveled from China to the US. And they're like, can you call this prescription in for my cousin or my college roommate
Wow.
that's in the US to see if they can get this? And I'm like, look, number one, it's the American Society of Immunology or Infectious Diseases doesn't support the use of plaquenil and azithromycin.
Yeah.
They recommend it for clinical trials, but not for regular, willy-nilly treatment. So for prophylaxis, it's even less approved.
Yep.
And there are other medications that are now being promoted and talked about, but in general, it's not for prophylaxis. So do not try. For those that are listening and watching, it's not about the treatment or prophylaxis with these medications. These medications are designated for specific treatment or specific criteria.
Yes.
The main thing is building up your immune system, which we talked about last week. Building up your immune system. Louis Pasteur talked about that it wasn't the microbe. The problem was the host. If you have a strong host, the microbe isn't going to do anything.
Absolutely. Yeah, that's absolutely right.
I love when you use those big doctor words like prophylaxis too, Joe. I want to remind our patients out there that that's not a birth control prevention type of thing like a prophylactic, everybody. What Joe's talking about it, and listen, the whole azithromycin and hydroxychloroquine thing is interesting because I don't think President Trump knows what a QT interval is. Okay,
he doesn't.
or
yeah, no, I thought that was very much he was out of line for purporting that because it had no basis in data or reality. And
listen,
now
I want to examine Dr. Fauci's tongue, okay, and see how many bite marks, okay, he's literally got on his tongue because. Now, Dr. Birx is different. Dr. Birx, to me, and I made this analogy to a couple of people, and everybody needs a laugh this morning. She's to me like they cut off an arm from Mike Pence, and it's like a stone crab. They grew an entirely another person out of Mike Pence. Because Dr. Birx, I mean, God bless her, and I respect her as a physician, like all the rest of us and everything. But I just find her to be so much more so towing that optimistic line, and Dr. Fauci, I think, is just so much more reliable, grown up in the room. And
yes,
and I just pray that Dr. Fauci continues to hang in there for as long as he can. He may not be perfect, but I think he continues to really espouse what we physicians, and I liken, a lot of these people like to Ray Rodriguez himself, just bringing it back to the Florida scene. Ray Rodriguez being the expert in the house because he did a Google search. Because he does a Google search, okay, of the articles about medical.
This is bad.
He reads Alex Berenson's book, okay, and mixes in a little Betty Crocker, Bertha Madras, okay. And seriously, how we know this is because he picked up on the Facebook post about THCP. And those of us who do our reading appropriately know that THCP was mentioned in one scientific article found in
very small study
cultivar, 33 times the affinity receptor positivity for CB1, and who knows what that means and what it doesn't mean. But to Jose Oliva, and Ray Rod, this became 1,000 times more potent, weed, dope, pot, weed in Europe that's causing schizophrenia and paranoia. No. And they were going to ban it.
I think that's just an agenda. That's just a deeper agenda.
The Justice League is an interesting, we have a group of doctors, and it includes a few non-boots on the ground doctors, including Greg Gerdeman, for a reason. It was Greg Gerdeman who brought up the point that when you can't test for THCP, and they couldn't, if that would have been slipped in there as somehow banned, believe it or not, theoretically, they could have circled all the way back to ban all flower because they can't test for the THCP content in flower. Isn't that crazy? So that's where the mind of the scientists, the Greg Gerdemans, go. But that's how you know how ridiculous Ray Rod and his like are, because they're not sitting up there in the stacks, nor is President Trump. okay, researching, okay, about medical
No.
issues and problems, right?
No.
Pulling the articles and doing this. No, they get their information in a way that's completely inappropriate for medicine.
No, they get their little news clips and their tweets.
Can I make another commentary? So I'm not going to show the front of this. I am distressed by some things that are going on in the industry right now, and I want to give a big shout out to my personal Certera rep, Christina. Okay.
Hey, Christina.
I don't know. Okay. I
Is
don't know if
she
she's on this morning or not. The entire Certera team was wiped out.
really all of them?
Fluent recently as well.
Wow. Really? I heard rumors, but I didn't know which groups, huh?
So
yes.
So Fluent has wiped out their entire sales team?
Well, I know that Keith Hughes, you know, who and if I'm wrong, somebody please post it out. But no, I believe Fluent also had a significant diminution of their educational team, let's call it that way. Certera as well. And, you know, it just bothers me. How it's been explained to me is that this happens in a lot of ways because Massachusetts, interestingly, closed down their legal adult use cannabis operations, right? And this has impacted Certera significantly, which made a trickle-down effect, so to speak, upon
Curaleaf too, because Curaleaf is based out of Massachusetts.
Indeed. Essential employees in a medical cannabis program. There's still so many doctors that don't know about medical cannabis yet, those practicing and those that have not yet entered our world, right? Patient outreach and access. We'll have conventions at some point again. We'll have outreach meetings and this and that. I don't know. I just want to give a shout out to some people behind the lines in this industry. And listen, we've all known them, and may he rest in peace. I think, you know, Bill Monroe would be the best example of that. It's not an easy business, and everybody's out there trying to make a living with passion, okay, in this industry, and it's vicious at times. It's vicious at times.
Oh, it's very vicious. And, you know, part of the issue with and I don't know if the other dispensaries are doing it, but one of the things Certera is doing, so one of the other reps told me, they're offering a severance packet, but that severance packet is contingent upon a non-compete. So they can't go and work anywhere else within this industry, and I don't know how long that non-compete goes for, but if they accept a severance package, they can't work. And then if they go back and try to get into a pharmaceutical industry and be a sales rep in the pharmaceutical industry, they're told, oh, you've been, they're just blown off. They're the people that are the sales reps with Certera are struggling.
But even the farm reps, for example, in just my regular farm reps that come to my office to promote whatever, they've not been coming in because all of them were pulled from the street by their companies, and they're doing, some are doing telemedicine. They're coming through our office and setting up, like they're buying lunch, they're delivering the lunch to our office, and then they set up a time where they go on Zoom and we can hear their, feel. But they've been pulled off. Yes, Tom.
I was going to say those non-competes that they're forced to sign. I'd advise anybody that has been put in that situation to speak to an attorney, because in some other states, non-competes do not hold, any merit, especially with federally illegal businesses like cannabis.
Really?
You know what, Tom? That is so interesting from that angle. Listen, I worked in the world of emergency medicine my entire career. We had all these non-competes, this, that, whatever. And listen, Certera, and other medical cannabis organizations, no rep is stealing any internal secrets of Certera's.
Exactly.
Going to work for another MMTC and impairing
it's BS
business, Tom.
Yeah.
I tell everybody a non-compete is only as good as the company that wants to try to enforce their non-compete, and the money they're going to chase, over you, going to work for somebody else. And believe me, in the medical cannabis world, there's been these disputes. Sometimes a company, they'll take patients, this, that, whatever. I mean, sometimes there are some harm and damages being done, But believe me when I tell you, but I find it insulting to me that they would even make these representatives of their company in good faith doing their thing, suffering from this particular, unless they don't value their educational staff. I don't know. But if it's truly just because of this acute economic emergency, to put a non-compete on those people going out and getting a legitimate way to pay their bills, are you kidding me? That is just wrong. It's wrong.
You know,
and
and a
I
lot
don't
of
know
the connections.
people at Surterra. I don't. But if they're watching, and I hope they are, okay, that's wrong. And people end up knowing that it's wrong. And that's why I wanted to bring it out in this because, listen, I value all of the people that are in this industry trying to bring the educational message out to the public. This is a medical program. In order to maintain it as a medical program, you need to focus on the education.
And I'll
that
tell
is
you,
true,
Surterra,
but for their safety, I understand the position of the higher ups wanting to do that. Also, a lot of doctors' offices have either shut down or cut back on their hours, and there's they have to look at the bottom line, and if they have to, if it's going to affect the prices of the medications for the patients, running a business, as both of you know, we have to keep the lights on.
got a bottom line.
I got it. But I just thought it was brutal to put that non-compete on there. And I'll be honest with you. Listen,
I agree.
I'm not telling Surterra how to run their business. But, all of these dispensaries are under some degree of stress right now because of the patients that are coming in with the ordering, with the order center, with the call center. You mean to tell me that they couldn't offer to each of these educational people, listen, go on into one specific dispensary closest to you. We'll make you a co-manager, so to speak, and you'll handle the educational outreach. I don't know why they don't discuss things with us. You can't tell me that Christina Rispoli can't go into the closest dispensary that's to her, and they can't hand out cards for 2 weeks saying, hey, on Monday, 2 weeks from now, we will have a virtual session with Christina Rispoli, our educator, okay? You can't tell me that there won't be patients in that 2 week period of time that wouldn't sign into a Zoom for them, and she couldn't help out. God, I hate to use her as a specific example. She's probably going to beat the hell out of me. But the point is, any of these people could have been, I think, morphed into something else. I don't know. Like I said, I don't run their business. And Joe, you're right. We're at half staff right now for a reason, because I don't want my whole staff being here exposed on any one given day. Right.
Yeah.
We talked about this last week. We're one test away from everybody being quarantined for 14 days.
Mm-hmm.
Yeah.
And people do need to maintain. I tell everybody, Tom, and you're the guy out there talking to a lot of business people. I tell everybody, if you can maintain 60% of your volume right now, then you're okay. And maybe you'll be able to cobble through. Let me tell you something else that happened. Our cabbage line of credit, okay, a couple of Fridays ago.
Yeah, got stopped.
Froze with no notice.
Yep.
Yeah. Oh yeah, Joe. And
they froze everybody. They froze my cabbage line. They froze everybody's cabbage line.
Froze it
for these, and then they're saying they're concentrating on the SBA money. When are we going to get when are they even going to see if they got this SBA money? I don't think people are going to get it anytime too soon.
So there are people. I've helped a few people fill out their paperwork and got confirmation of approval on a few already.
When are they getting their money?
The money yeah, that's the other part. Closing documents signed, and hopefully, supposedly, there's going to be a new website where you could go on and track the IRS money that's coming to you individually or as a business. But one of the things, they just had a write-up about a lot of the cannabis companies that are going to be suffering because sales were really high when they thought they were going to close, and now sales have kind of dropped off. And some of these companies that are in multiple states like Massachusetts or even in Colorado, where they're not allowed to do delivery and the adult use is shuttered down, that there's going to be an economic impact and no relief at all for those companies because the federal relief is not available
they can't
to marijuana companies.
Well,
what about doctors' offices? I know a lot of docs were asking about that if you're doing medical cannabis, because I went ahead and applied for it. Are they going to hold us to that same standard because we're also doing medical cannabis evals?
Yeah, but we don't touch the plan. I applied for it for the payroll protection plan.
Yeah, the payroll protection. Yeah, I did. I applied for that.
We applied for it in our office because, again, we don't touch the plant. We're a doctor's office.
I got it. I've just had the conversation with my merchant processor. With even though you don't touch the plant, if they look at your website or if they you know what I'm saying, they still kind of group you into that category. I've had that happen a couple of times with different funding opportunities, and they say, "Oh, you're medical cannabis, no, can't touch you."
Now with the hemp CBD companies, I know Janelle Ralph at Palmetto, she posted the letter from the federal government that they are helping those farmers.
They are. Okay.
Yeah, and there was a letter from the SBA that clarified it. I'm going to try and find it.
Listen, I think everybody needs to appreciate the fact that this is just completely uncharted water.
Yes.
My daughter, unfortunately, was laid off from her medical cannabis job in New York City. She works for Sativa with a C. That's an IANTIS, Grow Healthy here in Florida organization. They're down to 2 days a week up there. So, I think in general, the cannabis space, and Joe, you're right. I mean, I do appreciate the pressure at the top. And I tell everybody, listen, we have to protect the medicine. I mean, you're right.
Yes.
And if the whole system goes down because of their inability to maintain their payroll, there's surely no good in that for anybody. So, I may come down a little rough on Terra and other corporates, but my point is my point, and we're still, God, how unique this is, guys, and how much we know still needs to be done to the extent of advancing what we all want to have happen, with cannabis, which is, appropriate reforms, and where this is going to lead towards legal adult use reform, not only in Florida, but nationally, will be interesting to see. I had a discussion with Jack, one of my educators. What do you think is going to happen with the black market? You think the black market's going to thrive?
I think it's going to explode. It's going to do just like it did.
Or do you think it's going to dry up? Because you know what happens at certain times in the country. Sometimes now, I'm just talking old Ohioan and everything, and old days, blah blah. So I don't really know what goes on in the black market. Or quite frankly, do I care? But I think it's kind of interesting if you look at it from that perspective. If you really truly have a significant period of lockdown in the country, what's going to happen to the black market? Is it going to thrive? Is it going to dry up?
No, I think it's going to. I think it's going to thrive. I think it's going to thrive. My brother is so busy right now in California. He's very happy. He's one of those black market growers. He is. I hate to call him out, but he's busy. I think it's
so interesting though, Kel, because you have the center of the state that really doesn't have access to legal cannabis because of the municipality ban, out in California and everything.
Yeah. Right.
So that really fueled the black market, so to speak, is that when California went legal, they didn't really do it in a particularly smart manner.
Right. They did not. And it already increased the black market. So this has already increased it even more. But I think it's going to increase. I don't know. What do you think it's going to dry it up?
Like I said, I'm just an old Ohio kid remembering, around election time, around this, around that, So I don't know, but my patients tell me what they tell me, and they tell me that the black market actually is fairly spotty right now.
I want to share with you guys, if you got a second, I want to share with you what the SBA statement is.
Okay.
I just pulled up. So right here, it says any direct business that is in the business to grow, produce, process, distribute derivatives, regardless of the amount in such activity, is excluded, as well as any indirect business or firm that derives any of its gross revenue from the previous year from the sales to direct marijuana businesses of products or services. So really, they're kind of talking about, that provide marijuana testing They will be
Yeah, indirect.
smoking, but it doesn't say anything about physicians because physicians aren't providing to the facilities. Now, it also clarifies that CBD would not be excluded because that it fits into the category under Agricultural Marketing Act, I guess. Therefore, it would be eligible to receive the SBA funding if its legal business is under state law and is not about aiding in the use, growth, distribution, enhancement, or development of full marijuana. So I know it's kind of still a little unsure about physicians because it actually says places that sell smoking devices like pipes and bongs.
I think that's going to be up for interpretation, and banks are notoriously, number one, conservative, number two, they're going to have the final say. So I think that they, depending on the bank you go to, they could turn you down.
Absolutely.
So,
well, we covered a lot of stuff.
I mean, Chase closed down one of my accounts because my consulting business, International Medical Consultants, they went to my website, like Kelly just said, and they saw that, medical cannabis educator, they had my books, on the front, on the homepage. And I got a letter saying, we will close your account in the next 10 days.
Wow.
Well, they gave me 30 days, Joe. Everybody knows my story. I had all my Chase accounts closed. We actually have to use a small little state bank, First Federal of Florida. And, I kept my mouth shut about the application process for the SBA and all that type of stuff because I'm going to keep my mouth shut about it. I think it's very uncertain, Tom, to the extent of the eligibility of physicians because we provide the patients that purchase the product from the dispensaries. So, like I said, I'm going to keep my mouth shut about it because I'm going to keep my mouth shut about it. But, and also, quite frankly, my staff is working their ass off right now and half people in. And the telehealth business, let's face it, I mean, most of the patients that are in the program already, they're just happy to maintain their certifications.
Exactly.
I have 7 new patients today, however, that are going to require their level of teaching that, we demand in my clinic.
Right.
And, to me, my staff is stressed right now. And when we're reasonably busy, but I don't know that 2 weeks from now we're going to be able to be busy because we don't have the dispensation for telehealth.
Right.
So I don't know that 2 weeks from now, or somebody may test positive for COVID-19. I may have to close down.
Yep.
So it's anticipatory to a certain extent too.
Well, I think number one, we need to find out what the hell we're supposed to do in 2 days. I mean, we have to find that out just so we have an official yes from the state. We can still do this. I'm certainly not comfortable seeing any patients right now until and I don't know, and like you said, Barry, I think it should be 6 months to a year because we're going to have this same conversation in 2 weeks. We are,
if we do 6 months to a year, I will be making 100 masks.
There you go.
I will be passing them out to the Justice League
please do. I want mine.
I'll get you one too, Tom.
And I'm going to wear it proudly to the hospital too.
You know what concerns me if the dispensaries are getting rid of their education groups and they're not going out to the physicians and the patients aren't having an opportunity to really learn about the product. The only place they're going to learn about the product is from the bud tenders and the staff at the locations that they go to.
Yep. That's a problem, and that's what I was going to say about Cetera. Cetera really enjoys a great reputation for that. I send all my doobie ones to Cetera or Vitacan, but that's been my go-to since the beginning, and so they really enjoy a good reputation in that regard. They'll have and part of that is because they did so well with the patient outreach. with the teaching, and they kept their products relatively simple. You know, patients only had to worry about 5 to 1, 1 to 1, 1 to 9. You know, and that's all they needed at that level. So with them kind of gutting that whole part of their model is unfortunate.
And I think we're going to see changes in a lot of the other companies, like we had just mentioned, especially these mass companies, because I believe that report said some of them are about 8 weeks away from, running out of funding. And right now it's very difficult to raise capital in this environment, even for the public entities that are out there.
Well,
it's a tough time for all. So stay healthy, stay positive. Build up your immune system, like we talked about last week. Build up your emotional system.
Agreed.
Vitamin C.
What is that?
Give us a shameless plug. Go.
Is that vitamin C?
Yes. Yeah.
Yes. Yeah. 2,000. I take at least 2,000 along with some zinc every day. That you need that.
Kelly, you are my absolute hero. Keep doing your thing. Touch base
Thank you.
this week. I got a telehealth waiting for me, and I'm going to go do it.
Thank you so much.
I love what you're up to. And if you want to do these every Monday morning type of updates,
I like it.
I for one always enjoy seeing Joe. And of course, it will allow me every week to give my thanks to Kelly and all the time to get on.
No, all you guys know, this is great. I certainly every Monday morning we can do it and just kind of sit around and talk about. There's so much to talk about.
Yeah, maybe we could talk about things for patients since they aren't getting the education. We could cover some of the things that patients really want to know next Monday. So let's make it a date next Monday, and we could talk about inhalation and versus other.
And next Monday is 420.
Yep,
that's right.
It is 420.
Next Monday. All right. Well, 420. Let's do it on next Monday.
Okay.
All right. Thank you guys for your time today, and we'll see you next Monday.
All right.
Have a good
Bye-bye.
day. Bye, Joe. Bye, Barry.
There we go.